Hello everyone. Today we're gonna talk about how to choose your dentist, but not for Lucasita. Lucasita, go to the bed. We have 12 specialties in dentistry. The first thing that we should do is we go to a dentist that is compassionate, that is gonna give us the time, and that, just like any dentist, the specialist and the general dentist will be able to see, to diagnose your mouth, to give you the risk assessment that you have to produce decay, how much caries you have, if you have gum disease, if your gums are bleeding, if you're destroying your teeth, all the topics that we have talked before, all the problems that you can have in dentistry, your general dentist will detect them, and he will be like the captain of your mouth. And then if you start having some pain, then you have to visit the endodontist. And the endodontist is the one, like me, who's gonna take care of saving your teeth. And your teeth, we're gonna do, as we speak about root canals, remember, is if you have a problem of the tooth that the caries go to the nerve, you're gonna end up with a root canal. So you don't wanna wait until you're gonna be needing a root canal like you see on the roots of the teeth. Now, what do the endodontists do? Save your teeth, treat your nerve, and get you ready for your dentist, your general dentist, or your prosthodontist, whoever is gonna restore your mouth. Restorative dentist is the one you're gonna see. In case you have an abscess like this, you have to be sure you see an endodontist like me, and this is a kid. Also, you have to be sure it's not a malignancy in this case. Now, if you have a dentist like Dr. Vijay, which is a prosthodontist, then he's gonna be in charge of analyzing this mouth, analyzing the study models, putting them together like this in a way that he will see how you're biting your teeth, how much forces of mastications you are applying, what do you need to have in your mouth, if you need to see an orthodontist to straighten your teeth or not, how many implants, if you're gonna need implants. A prosthodontist plan in advance, and that is a specialty after general dentistry. That is 3 years to get to that point. Also, you're gonna have a full mouth reconstruction. You need to be sure that the person that is gonna do it is trained for this type of situations. If the general dentist said you're gonna need extraction of your wisdom teeth, for sure they're gonna send you to an oral surgeon, which is an oral dental maxillofacial surgeon, which are in charge not only of extracting the teeth, but they also are in charge of implants, preparing you for extraction of any malignancy when you have tumors. And I have a patient that I saved her life because I found an abnormality, very close friend of mine, and the oral surgeon did a biopsy and detected that it was a salivary gland tumor, and the patient could have died if we haven't detected that fast. The other specialty in dentistry is an orthodontist. In the orthodontists are gonna see in advance, but it's very important that you know that orthodontist also is doing dentofacial orthopedic job, which means when your kids are 4 years of age, he can expand the maxilla if it's needed, stop the growing of the mandible. So if your teeth is gonna have a bite where this is gonna be forward, then it's gonna stop the growing of the jaw to be able to create this type of ideal bite. And that is a good orthodontist. Or a gum specialist if your gums are bleeding. If your gums are bleeding because you're not brushing, because hormonal disease, for whatever reason I explained to you before, your dentist will try to clean your mouth unless you have an excessive amount of calculus. Then it's better that they're gonna send you to a periodontist, because you need to plan what are you gonna do, how are you gonna stop that. And there's many of the episodes I did before explaining how can you assess the risk, how to take care of your teeth, why it's important drinking water too. Now it becomes another specialty like mine. There's another specialty that deals with pain. One is endodontics, but what happens when the pain feels like it's a toothache, but it's on the ear, and it's on the head, and it's on the neck, and it's not coming from any tooth? You don't need a root canal. It can be a neuralgia of the trigeminal nerve, and for that, I will send you to neurofacial pain specialists, and they are in charge to check if it's a neurological problem, or it's a pathological problem, or is a migraine headache that is sending you pain to the teeth. Also, you can have pain of the root canal, like a root canal, and it's a referred pain, which is a topic I'm going to talk later, and then you ended up with a heart attack. Or endodontist, when you don't see an endodontist and you have an infection, then you can end up with a septic shock. So in order to avoid all these problems, that's when we have a show. The last but not least is an oral pathologist, where I was telling you that this specialist with another specialist, which is a dental radiologist, which is in charge of imaging, they're gonna detect, and the oral surgeon will extract the tissue to send it for biopsy and detect what type of cancer. Remember one thing, now I will have to teach you, for you and your kids, that oral sex can be a part of, we have H. pyloris that we're gonna transfer to the mouth and becomes like a carcinoma. So we need to get careful and be educated in that part. And again, a prosthodontist like Dr. Bijak will analyze your whole mouth, and you will be able to decide whether if you're gonna be able to analyze your mouth from your general dentist. Your general dentist is a difficult case, send you to the prosthodontist. And then another specialties like public health, which is analysis of the whole population in the United States, and together with another specialty that is epidemiology, are gonna be in charge to tell you who to go. And one of the most important is pediatric dentist. Pediatric dentist for kids is the one who's gonna check your kids first before a general dentist. For your kids, you have to go directly to your pediatric dentist. I will tell you today, since the mom is pregnant, it's very important to see a pediatric dentist that knows how to prevent you from cases that become a bigger problem when your child is an adult. And in the future program, we're gonna present in the next season about how you clean your teeth when you have braces in the kids and in an adult. It's something that we have to explain in a separate episode. Thank you. I hope you have any questions or concerns. Send your comments, press the like button, follow us on Instagram and TikTok. Thank you.